Today we will read about acute pharyngitis. Acute pharyngitis is an inflammation or infection in the throat, usually causing symptoms of a sore throat. Pathophysiology. Most cases of acute pharyngitis are caused by viral infection. When group A beta hemolytic streptococcus, the most common bacterial organism, causes acute pharyngitis, the condition is known as strep throat. The body responds by triggering an inflammatory response in the pharynx. This results in pain, fever, vasodilation, edema, and tissue damage manifested by redness and swelling in the tonsillar pillars, uvula, and soft palate. A creamy exudate may be present in the tonsillar pillars. Complications include sinusitis, otitis media, peritonsillar abscess, mastoiditis, and cervical adenitis. In rare cases, the infection may lead to bacteremia, pneumonia, meningitis, rheumatic fever, or nephritis. Uncomplicated viral infections usually subside promptly within 3 to 10 days after the onset. Clinical manifestations. The signs and symptoms of acute pharyngitis include a fiery red pharyngeal membrane and tonsils, lymphoid follicles that are swollen and flecked with white purple exudate, and enlarged and tender cervical lymph nodes, and no cough. Fever, malaise, and sore throat also may be present. Assessment. The diagnostic findings: streptococcal antigens, latex agglutination antigen test, and solid phase enzyme immunoassays, ELISA, and optical immunoassay, streptomycin titers, and also throat cultures can be taken. Nasal swabs and blood cultures also necessary to identify the organism. Medical management. Viral pharyngitis is treated with supportive measures. Bacterial pharyngitis treated with a variety of antimicrobial agents. Penicillin is the usual treatment of choice. If allergic to penicillin, the doctors may prescribe clarithromycin, azithromycin, and cephalosporins. Antibiotics are administered for at least 10 days to eradicate the infection from the oropharynx. Severe sore throats can also be relieved by analgesic medications as prescribed. Aspirin and acetaminophen can be used 3 to 6 hour intervals if required. Acetaminophen with codeine can be taken 3 to 4 times daily as ordered by the doctor. Nutritional therapy. A liquid and soft diet is provided during the acute stage of disease, depending on patient's appetite and degree of discomfort that occurs with swallowing. Occasionally, the sore throat is so sore that liquids cannot be taken in adequate amounts by mouth. In severe situations, fluids are administered intravenously. Otherwise, the patient is encouraged to drink as much as fluid as possible. Nursing management. The nurse instructs the patient to stay in bed during the febrile stage of illness and to rest frequently once up and about. Tissues should be disposed of properly to prevent the spread of infection. Important to examine the skin once or twice daily for possible rashes, because acute pharyngitis may precede some other communicable diseases like rubella. Warm saline gargles or irrigations are used to depending on the severity of the lesion and the degree of pain. This recommended temperature of the solution is high enough to be effective, as warm as the patient can tolerate, usually 105 degree Fahrenheit to 110 degree Fahrenheit, otherwise 40.6 degree Celsius to 43.3 degree Celsius. Irrigating the throat properly is an effective measure, reducing spasm in the pharyngeal muscles and relieving soreness of the throat. An ice collar can also be used to relieve the sore throats, severe sore throats. Mouth care may be added gently to the patient comfort to prevent the development of fissures, crackling of the lips, and oral inflammation. Resume the activity gradually. A full course of antibiotic therapy is very much needed. Nurse instruct the patient and family about the importance of taking full course of therapy. Thank you.